Welcome to Clear the Air with me, Angela Lim, medical doctor and co-founder of ClearHead, an innovative employee wellbeing platform. Clear the Air is a podcast covering those experiences in your life or questions you have that you feel too vulnerable to share with those around you, such as, why do I feel so lonely? And what can I do to feel happier? We get real and raw on these existential questions on mental health and well-being that's puzzled humans for millennia, sharing the science behind what you're experiencing and the answers behind those questions.
For most of us, pain subsides fairly quickly as we recover from injury. For some, however, pain persists, making it challenging to return to our normal, full-functioning capacity. In some cases, chronic pain may develop due to stress or even for unexplained reasons. However, due to the stigma and unconscious bias, individuals can feel too ashamed to ask for support, or when they do, made to feel invalidated in their experience of chronic pain. The research shows that recovery and resilience are deeply social processes, and meaningful support can change someone's ability to cope with pain. Our guest today is Dr. Claire Ashton-James, a social psychologist and associate professor of pain management at the University of Sydney's Medical School. Her work uncovers how social relationships influence the experience of pain and vice versa. Her research advocates for the integration of social treatments into the management of chronic pain so that people have the best chance of returning to full capacity and avoid relying solely on pain medication or therapy. Welcome, Claire.
Thank you, Dr. Angela, for having me on your podcast.
Amazing. Well, Claire, maybe to start us off, can you share with us what made you become a social psychologist that specializes in pain?
Oh, gosh. I was actually my main research for the first 10 years of my career was wellbeing, actually, and what makes people happy. I did happiness research, and I studied positive emotions and the role of interpersonal relationships in happiness. And then I suppose it sort of just dawned on me that happiness and positive emotions really facilitate social connection, right? So then I thought, I wonder what happens when people have chronic negative emotions. Like, for example, if they have depression, and I looked into depression a little bit, and then I thought, I wonder what happens to people when they have pain, chronic pain. And my sister at the time was a nurse who worked in a pain clinic. So I knew a lot about chronic pain from talking with her. And so I just became interested in the question of the impact of pain on social relationships, and the impact of social relationships on pain. And so that's sort of how I started studying these questions. And then I became really passionate about doing something about it, because I recognized that a lot of the treatments that we have for pain don't take into account the role of social relationships. There's an assumption that these aren't modifiable, so there's nothing I can do about it, so I'm just not going to even broach the topic. And you sort of refuse to take that stand. I think there is a lot we can do, and so that's sort of what I've been working on for the subsequent 10 years after that.
Wow. And I guess so that we're all on the same page. Almost everyone would have experienced some sort of pain in their life. But how would you define chronic pain?
Yeah, that's actually a good question. And just to preface everything that you ask, there are no simple questions when it comes to pain. And even just defining chronic pain isn't a simple question. It's something that people debate widely. I think we understand chronic pain probably in relation to what it isn't. So it's not acute pain. So acute pain is short-term pain that usually comes on suddenly and has a very clear cause, usually an injury, surgery, illness, that causes some kind of, fatigue or difficulty in bodily functioning. Acute pain typically lasts until the underlying injury, illness heals or resolves. Some people say that acute pain is only pain that lasts, up to 3 months, but as long as you've got an injury, you're going to have acute pain. So it's going to take as long as it takes, right? I currently have a broken ankle I'm recovering from an ankle fracture, and I've had, pain in my ankle for 8 weeks, but it's still acute pain. And I think what we need to know about acute pain is that pain in my ankle is really functional. It's really helpful. It's there to serve as a warning. It's there to stop me from, getting up on ladders at the moment, or running, or doing anything that might undermine recovery. So it's sort of facilitating my recovery, this pain, just to keep me aware of it and remind me that I need to be a little bit gentle with myself, rest and recover. Chronic pain is different in many ways to acute pain. It is not short-term, it's persistent. And what's interesting about chronic pain is it's pain that prolongs or persists well after the original injury or illness has healed. So you've got chronic pain once the underlying cause is no longer there. And but at the same time, it can be linked to ongoing medical conditions like arthritis and fibromyalgia and, nerve damage. But it can also persist without an ongoing physical issue or underlying physical issue or cause. So when pain persists and it's not a symptom of a chronic illness or disease, and there's no clear physical reason for ongoing pain, the pain in this case is actually an illness or a disease in itself. So it's something that can develop from acute pain, or it can from an injury, but it can also develop without a known cause. So chronic pain is difficult to understand because it is considered to be an illness, a chronic illness like diabetes or cardiovascular disease. It's an illness in itself, and we treat it as an illness in itself, as opposed to a symptom of something else. And while acute pain is really helpful and functional in that it acts as a warning and stops us from overdoing it with our broken ankle potentially, for example, chronic pain is not so functional in the sense that it does stop us from doing things, and it does have a huge impact on our lives, but it's not that lack of mobility and lack of activity isn't actually helpful for us. I think from a social perspective, and there are people who have theorized that chronic pain is, a manifestation of persistent stress, and that's a manifestation in the body of emotional stress. And then from that perspective, chronic pain is really a signal that we're not 100% safe.
Yeah, and often we mention that with mental health, it's only when it starts to affect your ability to function, whether that's pain or depression or anxiety, that's when you really should consider seeking extra help. And so when we think about pain or chronic pain, what are the common misconceptions that you've known having been in this field for a while?
It's an incredibly stigmatized condition. And if I think back to the way I interacted with people who I knew who had chronic abdominal pain, well before I started learning about pain, I didn't know anything about it medically. All I knew about was the impact it was having on this person's ability to function and how it affected the team I worked in the workplace. I have to admit that I have had made negative assumptions as myself. And then I started researching people's perception of people with chronic pain, and there's quite a lot of data showing that people with chronic pain are perceived as being less competent, less reliable, they're less likely to get promoted. They're perceived as less friendly. And there's all sorts of and this is all based on the fact that just they show pain behaviour. This is not based on any reality. This is just seeing someone limping or seeing someone chronically kind of guarding themselves or guarding their abdomen if they had a sore stomach, or just showing someone who shows pain behaviours tends to be automatically perceived in these negative ways. And that's based on stereotypes and all sorts of things, but it is an automatic process. But what I've come to learn is that chronic pain is really common. Like yesterday, for example, I Googled research into the prevalence of chronic pain after ankle fracture. And it turns out that estimates range from 25 to 60% of people who have an ankle fracture end up with chronic pain. So there's a good chance that I might end up with chronic pain. The prevalence of chronic pain after a motor vehicle or road trauma is up to 45% 2 years after injury. It's really common. And obviously the prevalence depends on the study and the study population. But my point is it's not uncommon. It can affect any of us. So if someone does have chronic pain, it's not, they've done nothing to deserve it. It's not to do with a lack of motivation. It's not to do with wanting to be sick or any of these sort of perceptions that we might have. It could happen to any one of us. And so, we really should be quite humbled and believe, really realize how lucky we are to have sort of gotten around chronic pain if we've ever had injuries ourselves. So I think the misconceptions from the research are that there's a lot of stigma, the perceptions that it's associated with people just being less competent or maybe a bit lazy, not really wanting to succeed, not being ambitious enough, these kinds of stuff. And it's absolutely not the case.
You spoke about how you had misconceptions yourself before you got into the field, and now you've learned all these things about it. What have you changed in you and how you behave or show up for the people in your life with chronic pain?
Yeah, empathy. Well, first of all, we need to realize that there's a lot of people in our lives that have chronic pain and that we don't even know about it until we ask them. Like if you ask 10 people today if they have persistent pain, at least one or two of them will say that they do. So a lot of people live with chronic pain and no one knows about it. But at sometimes chronic pain can become really bothersome and can interfere with life and have a really significant negative impact on people. And that's usually when we know about it. And for me, the main thing is to be there for those people with empathy and compassion, and keep in mind that could have happened to you. It's not. It's just luck that it didn't happen to you, and support that person to do what they need to do to manage that pain, because many people can live with chronic pain well. But it really does depend critically on their social relationships and how people treat them. So if we're aware of that, then we can choose to facilitate someone's success and whether or not they thrive, or we can thwart it. And it really does have a lot to do with how we react to people with chronic pain.
Can you give us some specific examples so that our audience listening can either modify their behavior in terms of how they're responding to people with chronic pain, or maybe what they can do to ensure, as you said, that these individuals can thrive regardless of the pain?
Concrete things they can do. Look, I think it's the first step in overcoming any implicit prejudice that we have is to recognize it. And often we can recognize it by the feeling that we have in our body. It's really hard for people to come to terms with this, but, prejudice and discrimination is quite automatic. It's something that we've learned through socialization. And so, and it's the same, any prejudice that we have towards people with chronic pain, you'll just sort of feel some negative emotion towards that person, or very, very small, some level of misunderstanding or some level of frustration. And I think it's important to recognise that and not pretend that it's not there, because it's only once we recognise it that we can do something about it and actually overcome the impact of that implicit bias on our behaviour. And then we can actively overcome it, and we can actively overcome it by putting ourselves in that person's shoes. And it's very, very simple. But just imagining what it would be like if it was you, and it very much could be you. How would you prefer to be treated if you were in that situation? And I think that's a useful guide. But you can always just simply ask someone how they wish to be supported. It's simply asking. If we can't, we're not mind readers, right? And I think it's okay to say to someone, please let me know how I can best support you. Everyone's different and everyone's needs are different. So encourage people to communicate with you.
Beyond the individualized approaches to asking one-on-one, what can I do to support you? Are there systematic things that workplaces or managers can look at doing? As you say, the prevalence is pretty high, so you might as well assume that there are employees that are being affected by this.
Yeah, that's a good question. I think certainly awareness would be helpful, some awareness of the prevalence of chronic pain. Then, so in whatever way you communicate with people in your organisation, in the same way that there's been a great push towards destigmatising mental health and depression and anxiety in workplaces by making sure people are aware of how prevalent it is, and especially after COVID, the prevalence has increased. Interestingly, the prevalence of chronic pain has also increased post-COVID, so it really is something that many of us in the workplace are actually living with and dealing with. In terms of systemic practices, if you can sort of work on the culture of the organisation so that validation and empathy is sort of the first response to people who are functioning differently to you. Curiosity and a desire to understand their needs. In terms of managing sort of performance, it would be the most effective way would be through encouragement without pressure. It's important to provide gentle motivation to stay active and engaged, and to have the benefits of work. So work is actually really important for pain. People who work have better outcomes, So when you stop working, chronic pain tends to get worse. So work is really important for managing pain, and people want to work. It's good for their self-esteem. It's good for their identity. It allows them to have social connection, and it allows them to sort of self-actualize and be competent and achieve mastery and be curious. There's all these benefits of work. And so we can provide gentle motivation for people to achieve their goals without insisting that they push through pain or do anything, just ignore pain or give these messages that aren't very helpful. And then often just practical help, like, ensuring that people can work flexibly so that they can work around pain flare-ups. Having social support systems in place at organisations is really helpful. It might be that there are peer support groups in workplaces might be something that could be helpful. Opportunities for people to help each other. Actually, the person with pain will benefit a lot from being able to help other colleagues. So a lot of like collaboration and fostering a culture of helping each other and caring for each other, and rather than cultures that are sort of dog eat dog. I think those sort of dog eat dog cultures wouldn't be very helpful, but cultures where people realise that everyone wins if we connect and collaborate, and it's a win-win if we all pool our resources and expertise and cooperate rather than compete. Those sorts of cultures are where I think people with pain will be able to thrive.
Mm. And how does all of that sit in the context of, your more traditional way of looking at pain management, which is, pain medication, maybe potentially therapy? How do you see these social structures and support in the context of more traditional treatments?
Well, it's an interesting question because pain is really a social experience, and many studies have actually found that medical treatments for pain and psychological treatments for pain are less effective for people who don't have a strong social fabric in place. So arguably, we need to get the social fabric right in order for these other traditional treatment approaches to really work effectively. So yeah, I am biased, but I think that the social context and people's social relationships are the first thing we need to get right, and then that allows them to respond to other treatments for pain. So they work together cumulatively.
As an individual who is experiencing pain, I could easily see that individual can just go to the doctors and say, look, I've been feeling really bad pain. It's keeping me up at night. Please, can I have some pain medication? And the doctor just needs to write a script, and I'll get my medication, and then that will help. But in the context of what you just said around the social fabric around me, the social support, maybe I am just surrounded by people who have these misconceptions, and they either think that I'm pretending or they think I'm just being lazy, all the misconceptions you mentioned before. What can I do in this context to change my social fabric in a way that is supportive, the same way that I can go to a doctor and ask for a prescription?
Seeking out social connection from places outside of those areas that aren't working for you. If I was in a workplace that had where bullying was rife and people weren't supportive, and I had really chronic pain that was really affecting my ability to function, that really required me to seek out treatment, then I would be looking at ways to boost my social connections and social support. And I probably wouldn't look for it in that workplace because that's going to take some time. You can't change necessarily the organisation that you're in straight away. You can't change the family you're in. You can't change the behaviour of your spouse necessarily straight away. But you can seek out other social experiences that would have a buffering effect, that would boost you, that would fill you up or top you up. So, weighing up, you can't avoid negative social interactions because we're humans, right? We have the capacity to be hostile with each other and impatient. That's part of the human experience. We can't avoid conflict. But we can help ourselves to be able to cope with conflict by filling up our cup with social interactions that are positive. And so where might you do that? You might choose to go and participate in a hobby where you might be with like-minded people. You might decide to prioritize that time where you know what, actually I'm going to go out and do the painting and Pinot or whatever they call it, where people go and paint and have wine together. Or I'm going to go on that, I'm going to join that walking group. I'm going to go down to the men's shed. In Australia, we have this thing called the men's shed that a lot of men go to, where they go and tinker with things and fix stuff. And they don't even have to talk to each other. They just share it. It's shared activity, right? It's a shared space, and it's a safe space, and it's a connection that's not hostile. It's supportive. It's a supportive environment. You might, instead of not going to the school breakfast because you really feel, you're in pain, and it's hard to leave the house when you've got chronic pain sometimes. You might not be motivated to leave the house, but if someone explains to you the value of that social connection for your health and well-being, then maybe you'll be motivated to go and have that coffee with people that you don't know very well and start building those friendships and having these sort of building up those weak social ties, which are actually very important. Even actually just getting a coffee from a cafe. I mean, people talk about millennials spending too much money on avocado and toast and coffee. But actually there's a real social value in going out and talking to the barista, ordering your coffee. They know your name. That makes you feel good. Like there's a health benefit to that brief social interaction with the barista. And I just the brief conversation that you have with the person about their Labrador or their golden retriever while they're getting their takeaway coffee, these just remind you that, people are, you get that feeling of being part of something greater than yourself. So that's something that we can prescribe. But, we can actually use our prescription pads to prescribe more social interaction. It might involve talking to our patient or client or employee about what they like doing and prescribing that for them. What do you like? Walking on the beach? Do you like coffee? Where do you get your coffee? Oh, I save money. I make it at home. Maybe once a week, let yourself go and buy a coffee, talk to the people at the takeaway stand, like just prescribe social interaction. You can do that. Call a friend who lives overseas. They don't, you can't see them in person, but you can talk to them and it'll make their day. Call someone who might be struggling. That's another thing you can prescribe. There's quite a lot of research this goes back to the research I used to do on health and well-being and happiness, is that helping other people helps us. It reduces the experience of pain. So pro-social behaviour, thinking about others, helping others, it has huge effects on pain and also just our capacity to cope with it minimises distress associated with having chronic pain as well, because it makes us feel useful. Like we're still useful, we're still handy to have around. We have a meaningful role in society, and so sure, we've got pain, and that is hard to cope with. But again, it's about balancing it with, yes, I've got pain, but I've also got all this other stuff to live for, right? So that's what we should be prescribing: meaningful social connections and meaningful social roles and relationships.
Can I take a slightly contrarian view to your comment about pain being a social experience? So what about if, as you have suggested, I go out and I find patient support groups of other people experiencing chronic pain? And through being part of that group, yes, I feel very supported because these individuals, they understand what I'm experiencing because they too have chronic pain. But would you ever have the opposite outcome where I now feel more pain because all I'm being told is, yes, you have pain, and yes, it's very debilitating, and you're being reinforced about your disability by people who understand what you are experiencing, but they potentially might be feeding you this opinion that, this pain is overwhelmingly affecting your life. Do you see that opposite effect instead?
Yeah, look, I've heard people who are quite prominent in the pain world, in the pain research world, talk about their concerns about peer groups, peer support for pain. I think I don't agree for many reasons. And one is that in some research that I have actually done with peer support groups in pain, we found that people's sense of belonging in the world and global sense of identification with other people and feeling of sense of meaning and purpose in life increased when they had intensive interactions with other people who lived with pain. And remember, if someone is really struggling, and it is actually really hard to live with chronic pain for some people, that's a fact, whether they've got support from people who understand it or not. It's not going to make it worse just because they're going to be struggling and in distress, whether what is it, that misery, I don't know, what misery loves company, or you could interpret that as just quite literally, you do feel better when you've got someone to say, compare notes with about how awful something is. It's not making it more awful to share your misery. It's actually making it less awful because you're not the only person going through it. And okay, so something people might relate to is, for example, parenting. There'll be maybe lots of people with adolescents listening to the podcast, or young children. And one of the most enjoyable things as a parent is being able to commiserate with other parents about how hard parenting is. Like, you laugh, you cry, and you find yourself saying, oh my God, it's so good to hear that someone else is going through this too. And why would that not be the same living with the struggles of chronic pain? Having a laugh about, how hard things are, and sharing that experience is just makes you it's less alone. This feeling that you're different from everyone and no one understands, that's very isolating. And we know that loneliness increases, that worsens outcomes in pain. That people with chronic pain who are lonely have much higher levels of disability than people who with chronic pain who are not lonely. So wherever you can get social support from, whatever that looks like, I think it's all helpful.
That's good to know. Are there examples of when people, through interaction, make things worse then?
100% there are. And there's quite a lot of research into couples, actually, and the impact of couples, spouses and partners' behaviour, and parents of children with chronic pain. Quite a lot of research on how our partners and close others can amplify our pain, and also make it more or less difficult to cope with pain and manage pain. So certainly those who are around us affect our ability to our perception of pain and the distress we feel in response to pain, and affect the meaning we ascribe to pain, and the importance of the pain, all that kind of stuff.
Basically, as you said, often these individuals come from a place of unconscious bias. And have you ever looked into, for example, the unconscious bias that can also come from what you would consider informed individuals, like health providers, like your GP, or, someone who is technically a professional, but maybe not specialized in pain?
Yeah, that's an astute question. And sadly, there's quite a bit of evidence that healthcare providers are biased against people who present with chronic pain. There are assumptions that people are, not copers. There are perceptions when females go to primary care providers and mention that they have chronic pain, there's even more stigma. That somehow it's to do with the fact that they're just not resilient enough, or they're just overly sensitive, or it's really, there is a lot of it, that implicit bias that I mentioned at the very beginning earlier in our conversation, that we all feel, because unfortunately we are human. Like, there is a function to implicit biases that, back in the day, it helped us to figure out which tribes to trust and which tribes not to trust, and helped us not to get killed and things like that. So it's part of, our evolution. It performs a social function. And unfortunately, what I have found in my research is that people do have these implicit biases that are negative in relation to people who show pain. And healthcare providers are humans, it turns out, and they're not any different. So, they also tend to have a bias towards thinking that patients with chronic pain are, more difficult and more sensitive, more emotional, that kind of thing.
How would you sort of advise individuals with chronic pain to advocate for themselves? And is the route to, continue investigations, or, you might not be able to quite comment on this, but it is, as you said, quite invalidating for individuals to see health professionals and be dismissed about their pain, and that maybe it's not real, or they're not coping, or not very resilient. Do you have any advice for those individuals?
Well, I mean, first I would say that you're not alone. You're not alone in feeling invalidated by healthcare providers. It's not just people with chronic pain who experience invalidation in medical encounters. It's quite common. So it's not just you. And then I guess I would say that I know it's just really that the experience is awful. It's very disempowering to feel like you go to someone, you asking for help is a vulnerable place to be. And then to have someone say you don't need help, or you don't deserve help, or there's no help available for you, or everyone I know who has this issue is fine without medications, that kind of stuff. Where does it leave you? It leaves you even more vulnerable. Look, having had medical issues myself, I have been in a position where I've had my concerns invalidated and dismissed, and I couldn't do anything in the moment because it was so overwhelming. Like it was so disempowering. So to expect people to be able to advocate themselves is almost like it's a contradiction, because when you are dismissed, you are so disempowered that to advocate for yourself, like, where do you get the resources to do that? It's really difficult. What I have personally found helpful is to take in a list of questions that I write down that I want answers to, because in the moment I just want to get out of the room, and I just don't want to be a bad patient, and I don't want to annoy the specialist, and I want the specialist to like me so they give me good care. And it's really complicated. It's a complicated interpersonal situation, healthcare. So I have found writing down the questions that I have for the specialist to be really helpful, and just ask them, like, make yourself say, I have a list of questions. Would you mind if I go through them? They might sound silly, but I just want to get through all of them. And then, once you ask permission, then the specialist, the GP, whoever your healthcare provider is, once they give permission for you to do it, then then they've allowed you to, and you'll have the space to do it. So you kind of formalize the process a bit. You go through the questions, and you might be surprised that, when you ask the questions that you're scared to ask, I think that eventually you'll get the answers that you want. And it takes someone who understands pain, someone who understands the holistic impact that pain has on people's lives, to give you the validation and empathy you need, and also explain to you what is going on and how you can manage pain in ways that do actually work. One of those ways is through topping up meaningful social connections. Another way is cognitive behavioral therapy, and another way can be medications, but they all work together,
Yeah, and such a good reminder, Clearhead is an EAP provider, so if your company uses us, we do have therapists that specializes in pain, and sometimes it is about not trying to bang your head against a brick wall, but starting with a specialist that is able to understand what you're experiencing and then guide you through the system of, okay, where else can I go? Whether that's accommodations at work or whether that's seeing a different pain specialist. But, starting with being able to see someone who can understand what you're experiencing and give you ways in which to cope as a starting point. And obviously slowly educate the people around you to be more empathetic, to be more understanding, and to be more supportive. And obviously, as you said at the beginning, that the stigma is real, that these biases does affect your ability to be promoted, to be given interesting projects, because people perceive you as incompetent. So if you are a manager or a colleague, for example, friend or a spouse who sees someone maybe might be struggling with pain, what's the best way to approach checking in with them and asking them if they need help without maybe potentially offending them or putting them on the defensive?
The best way would be to be authentic in your approach. I think every communicator, everyone listening to this podcast has their own different personality and character, and our colleagues know our character. They know who we know. They know all our quirks. I think the most important thing is that you go up and communicate that you are concerned and you care and want to know if there's anything you can do to support them. And you communicate that in whatever way is natural and authentic for you. That's my advice. I acknowledge that I'm quite different in that respect. I really don't adhere to or promote standardized communication strategies or structured communication, strategies. I think people know when you are genuine and when you care. They know what your intentions and motivations are. It doesn't matter what you say. They know because of your nonverbals. They know because of all the things that we can't control about communication. So if you think someone might be struggling with pain and it's affecting them, just say, hey, how are you doing? Like, is there anything that would be helpful? I think that's where I would start.
That's great. We've covered a wide range of how to think about social relationships and the impact on pain and vice versa. Is there anything else you want to share with our audience that we haven't covered already?
I guess I would just end with maybe some empathy that, I've been talking about how important social relationships are and social connections are and how important it is to build those social connections. It's also important to recognize that it's difficult, that it is challenging. There is an obstacle to doing that, and that chronic pain can be an obstacle to that very thing, to doing that very thing that's helpful for us. And it is a very real barrier to it does cause social withdrawal. So I'm suggesting social connection is a really clear answer, but I'm also acknowledging that it's not an easy answer.
And so, as you said, if it's painful for me to be standing on my feet for more than 5 minutes, and as social interactions often involve me being on my feet for potentially 1 to 2 hours, it's very easy for me to just make the conclusion this is too hard. What do you advise those individuals on how to maintain those social relationships and connections?
Well, seek out alternatives. As I was saying, sometimes it won't be possible, and I don't think you should blame yourself or make yourself hurt yourself, and just do what is possible. So maybe the social event goes for 2 hours, maybe you only go for 15 or 20 minutes, but at least you're there. You say hello to everyone. You can't stay for long. And then you go, but it's better to have something rather than nothing, right? So we want to avoid that all or nothing approach.
Awesome. Well, we love to end these things with one question, which is, Claire, what is your one wellbeing practice to stay mentally well?
Exercise. I broke my ankle riding a horse. I am a horse rider. I do endurance horse riding, and so I know a lot about acute pain from endurance horse riding, but it's one of those interesting things where it hurts to do it, but it's good for you.
That's it for today's episode. If you want to learn more about how Clearhead can support your workplace, or you have a burning mental health question that you'd like us to explore on the podcast, check us out at myclearhead.com and drop us a message. Love our content? Share it with a friend or leave us a comment on LinkedIn, Instagram, or Facebook. Thank you so much again for listening, and catch you on the next one.